The best way I can describe SHEN is to say it is an emotional healing technique that leads to a sense of self-empowerment. It was developed by somebody called Richard Parvek, whose background was steeped in physics, and he was fascinated with fields and how fields worked. And in the human body, every molecule has a tiny electrical field around it. The sum total of all the molecules within the body form the biofield, as the scientists call it. That's the official name for it. And this biofield was observed by Richard Parvek, who realised that it had movement. It flowed around the body. And it was during his experiments and laboratory work and clinical observations about this flow that the biofield has within the body, that when he was using the chi, or the biofield flow between his hands, when he came to certain regions in people's bodies that he was following the flow, they would say to him things like, "When you put your hand near my heart, I felt sad. Why? When you put your hands near my solar plexus, I felt angry. Why?" And he then started to realise that emotions were in the body, and the emotions actually live within the torso. And you find that emotions are centred around the heart centre, the solar plexus centre, just below the navel, and the root, or the base of the spine area. What Richard Parvek did was, because of the scientific background he had to then set all this down and chart this. So he charted the flows of the biofield and how the biofield works. And the biofield basically balances the body and keeps the body in good order. If something stops that biofield, then that's when problems arise. What he also worked out is the mechanics of the emotions, and that briefly means that if the body has pain in any form, whether it be a physical pain like a broken bone, or whether it be an emotional pain like grief, for example, over the loss of a loved one, the body's response is always the same. It's identical. It's called the autocontractile pain response. That's the term that the medical profession give it. All that means to you and me is it contracts around the site of the pain. Sometimes it's called the splinting effect. So if you fell over, if you broke your arm, the arm would immediately start to swell and go stiff, and that's the splinting effect. And the medics would come, they'd put a temporary splint on it, take it to hospital, they would set the bone, put a plaster cast on, which is another splint, and then 10 weeks later they take it off and hey presto, your arm should be okay. If on the other hand you've suffered a pain to do with, for example, the loss of a loved one, then if you haven't grieved, which is a normal process, and many people find it very hard to grieve, then the body senses that pain. In this case, that pain will be centered around the heart. So you get a contraction around the heart. And what that contraction is doing, it's like putting your foot on a hose pipe. Obviously, you're watering the lawn and everything's fine, and you step back, put your foot on the hose pipe, and you suddenly think, where's the water gone? Or the pressure goes much lower. So if you've got a contraction around your heart, it's like me putting my hand inside your chest and squeezing your heart. That would be pretty painful. So the heart is a muscle. So if the muscle's contracted, it's not working properly. It also affects the arteries and the veins and the muscles around the heart, and also the lymph glands. And you have that sense of everything being pulled in, and it holds that in a contraction. And it holds it there until such time as it's released. And that can be many, many years after the time of the original trauma. In this case, for example, the loss of a loved one. We use the aspect of our own biofield, which is sometimes popularly called chi, that flows from one hand to the other, and we put our hands in certain prescribed positions that we're taught during the SHEN trainings to work with the biofield of the client. And what happens in that situation is that the client first of all starts to relax. Then as the client relaxes, naturally tension starts to leave the body. So very often there'll be twitching or jerking just as the tension leaves the body. As we start to work deeper and deeper into the body, those contractions I spoke about start to dissolve, and then they open. And as they open, up will come the emotion. Usually the emotion is attached to a memory. So you might suddenly think of that loved one that's departed, and suddenly the thought of that person will then bring up the emotion, and you'll grieve. And it's a very short-lived experience usually, but it will come up, you'll experience it, and then it's released. And then all the conditioning that's taken place following that trauma just dissolves. So you don't need to think about anything because it's just gone. So all those feelings that you've had all your life about, why do I feel so angry about everything, about life, about people, about situations, suddenly when you realise what the source of that anger is, because you've gone into it and you've experienced it, it loses that charge over you and you're free. And then you start to feel a sense of empowerment because all the conditioning has fallen away.
Well, I've just received a double dose really of SHEN. I do sometimes feel that sort of anger and that frustration and that knot in the stomach, which is obviously the knot, the tension in my solar plexus, isn't it?
Yes.
And that's been released in the last 2 hours. I feel terribly relaxed at the moment. So just explain what we went through.
First of all, it's important that I went through a history so I can understand what the issues are. And as the SHEN therapist, my job is to see where I need to work. Grief, for example, that you don't feel that you've grieved because of the loss of this loved one. When you think of that, where do you feel it in the body? And if the client puts the hand on the chest, for example, around the heart, then I know that that's where the pain is. So from the point of view of the therapist, I'm looking for where the pain is. And then what will happen is I usually begin by putting the client into a state of relaxation. Sometimes that emotion is already up, in which case I'll go straight to that spot and I'll start working on that spot. But usually it takes a little bit of time, and I begin by relaxing the client by simply doing flows around the peripheral edges of the body, and that usually starts the process of relaxation.
And this is done in total silence, isn't it? There's no music to calm you, to soothe you. There's just nothing but the ticking of the clock and your hands gently on that spot.
That's exactly right. I mean, from my perspective, SHEN is for the client to experience, and what I'm not really there to do is to influence. I really am, if you like, the midwife in a sense. And I'm kind of giving birth to this painful emotion, saying, you can come out now. So it isn't necessary for me to speak. It's not necessary for me to try to influence the client unduly. I might say an odd word here or an odd phrase if I can just see that the client needs a little bit of reassuring that it's okay to let go. So having relaxed the outer part of the body, and I can see that the client's beginning to relax, I then move to the centre that I want to work on, and I work at relaxing the area around that centre much, much more deeply. Then the client correspondingly starts to go much deeper, and then I can see from observation that things are happening.
You're lying there, your eyes are closed, I can hear you breathing, and I can sense that your hands are resting on my shoulder, my arm, or my stomach, and I'm thinking to myself, I haven't done the shopping, I need to get this in for tea. And you're thinking, why can't you switch off? And then suddenly it's that deep, deep breath, and you're totally relaxed. You feel light.
This is just simply your body saying, wow, this is great. I've actually got Mandy where I want her. And that is being still, being quiet for a moment, taking a little bit of me time. She's got nothing to think about, nothing to do. In fact, the less that she does, the better this is going to work. So that's what I'll give her. I'll just simply switch off all systems and just relax and just enjoy the ride. If I do a retreat, and I love retreats. Retreats is probably my favourite way of giving SHEN, because I'm with somebody for as long as they want me. I mean, typically, I get a lot of people from London and the southeast that come up, and they usually come up on a Friday morning very often if they're working. They get here about midday. I settle them into the apartment. I suggest they go wander around the town, and then we start SHEN, say, at 2 o'clock. I do a double session till, say, 5. And then it's all geared around what their requirements and needs are.
Okay, we've come down from the sanctuary upstairs down to the second floor of your property here, and we've walked into a fantastic room. Beautiful, beautiful fireplace. This is the sitting room, I take it?
Yes, that's right. The house was originally built in 1599, and we've got a lot of evidence as the provenance of the house. We know who built it and who lived here and so forth. This is one of the oldest parts of the house. If you look at the floors there, everything slopes here.
Gosh, it does, doesn't it?
Everything slopes here, and it's all held up by
the
by
old beams.
Yes, but it's the silence here. If you just listen for 1 second, there's absolute silence here. You're right in the centre of the town.
But you wouldn't know it, would
No.
you?
And you've got complete silence. So from the point of view of the clients coming, they will come here, they have their own entrance to the property from the outside, and they come straight into the apartment, and the therapy centre is 1 floor above, so they just walk up a short flight of stairs, so it's perfect from that point of view. If they wish, they've got 26 food outlets in Bewdley, restaurants, bars and takeaways and so forth.
But if they don't want that, they've got their own kitchen.
There's a fully equipped kitchen, yes, that's right. And we've even had people say, we came to you for SHEN, but can we come and book this for a long weekend?
Can people do that? Or
Yes, they can. I mean, it's not for that purpose. It tends to be, it's for SHEN. And almost invariably when they get here, they say, well, whilst we're here now, can we have some SHEN? But yes, it's lovely. And
everything you need in here, cooker, fridge, microwave, everything in there. And then across the sitting room, up, it feels like you're walking uphill because the floor is so uneven. Got an amazing bathroom. All this is an original door, isn't it?
it is completely original.
Gosh, how old is that?
It's probably about 400 years old, the age of the property. But you can see it's very, very thin.
Yeah.
In fact,
Bowed.
what I don't think you saw up in the heating room, we have an original door with an original wooden lock. So this is before the days of metal locks. And it doesn't have a door handle, it has a pull. And that lifts the lever that opens the door. So that's, again, another original feature of the property.
So down the hill again and across, we're going into the bedroom. This is not an original door, I can tell that one.
No,
And there's a lovely bedroom in here with everything you could need. Bed, wardrobe, library, mini library.
Yes, and it's all designed to give people a sense of being nurtured. They're in a safe environment where they're just surrounded by everything that they could possibly want to make it a comfortable experience. And what's very, very important, particularly when people are coming on retreat, is that they feel safe. And that allows then for trust to build very quickly. And a lot of people go away and they say, it was a wonderful experience because I just felt nurtured. I just felt like I was being wrapped up in a big warm blanket.
Well, you are, because you did wrap me up in a big warm blanket.